This series, Inclusion St. Louis, which is part of our Festival of Nations season, is really intended towards achieving the vision of the International Institute, which is an inclusive St. Louis. And this week, we are specifically talking about healthcare inequalities and how they could be an impediment to achieving our goal of an inclusive St. Louis. Is an inclusive St. Louis possible in your opinion? If yes, how? And if no, why? And we'll begin with Dr. Marco.
Of course, we can have an inclusive St. Louis. I can't even imagine not to have an inclusive St. Louis. As an immigrant, as somebody that I found my home in the United States, I know that there are challenges. I know that my community and our community and your community, everybody's immigrant community has challenges and of course difficulties, and it's maybe harder for many, many other groups.
Yeah, it looks like the community is onto something. We feel that there's been a lot of work done. There's energy around working towards having a more inclusive St. Louis, and we're hoping that through these conversations we also play a small part in advancing that initiative or that movement towards a more inclusive St. Louis. And thank you for being here. Diego, talk to us a little bit about the mission of CASA de Salud and how it pertains to this conversation about healthcare inequalities, especially for those with limited access.
Yeah, of course, absolutely. So CASA's mission is to facilitate and deliver high quality clinical and mental health care services to our region's under and uninsured. And we focus particularly on immigrants and refugees who encounter barriers to accessing this care from other sources. And the way we do this is by building a model which is founded on partnership. And what happens at CASA and what makes CASA unique is that we surround that technical expertise, that medical and behavioral health expertise, with multicultural, multilingual staff, folks who have sort of walked in the path of the immigrant, who understand that journey. And so what we do by putting these two incredible forces together here in our region is we provide patients and clients the inclusive care that they need today, the support that they want right now, and at the same time, we're building a more inclusive healthcare safety net for tomorrow.
What are the most important steps we should take to reduce healthcare disparities, for example?
Back in 1906, we began serving the newly arrived immigrants to the surrounding area, and gradually, as we expanded, we began to serve others who had great needs. So currently we provide care to over 43,000 patients, and 90% of those patients have incomes under 100% of the poverty level, and almost all of the other ones, the other 10%, have incomes under 200% of the federal poverty. So people in great need, and of that number, about 70% of our patients are Black and 14% are Hispanic, and then a smattering of patients from many other cultures, making up about 11% of patients who receive their care best in another language. So that's just kind of showing the breadth of what we do in terms of that diversity.
Why is it important as a community for us to address these inequalities that exist? Why is this vital to our progress as a community?
I think that for me, the reason is at once simple and complex, and that is that we're all connected, and that as a community, we need each other, and we make each other better, and we make each other stronger, and we help each other grow. And so we are smarter if we think about not only our own well-being as a family unit, as a neighborhood unit, as a city, as a region, but also of those around us and those who live with us. And so I think that's important to think about these inequalities as affecting us all in different ways. At some people, obviously, much more directly than others and much more systemically than others. But I think we would be wise not to believe that just because we don't suffer directly from some of these inequalities, that they aren't affecting us in our lives and in the way that we interact as a community.
Thank you very much, Diego, Mirella, and Yvonne, for doing this. This conversation is going to continue. I hope it doesn't end here. Next week's topic is going to be about projected big arrivals of refugees into this area. Is it an opportunity or a challenge? And I'm going to invite our audience to be back again. We're going to have a very engaging panel